Hello and welcome to this episode of AUMHUM Talks. Today our guest is Dr. Hariom Singh, a well-renowned neurologist, somebody I have known for a very long time. Dr. Hariom has a wide area of interest, all the way from headaches going to movement disorders. He has a number of clinics spread all across Lucknow. He comes from a pedigree of All India Institute of Medical Sciences, and we are extremely delighted to have him here. Dr. Hariom, welcome to this episode of Aman Talks.
Thank you, Aviral, and thanks again, Aviral, to giving me the opportunity to address the audience.
And in this episode, as usual, I'll be joined by my colleague Soumya Singh, who would be putting together, who has in fact put together a good number of questions that we will be putting in front of Dr. Hariom. To start with, when I talk of headaches, uh, it's very easy for me to confuse any headache with a migraine. In fact, it's like I would say we are living in a culture where it's kind of aspirational to call a headache a migraine, right? I don't feel good calling my headache a sinus headache, or I in fact don't even know what is a sinus headache. So by default, I go back to migraine, and it's like there's a charm to the word. Are all the headaches migraine, or is there a way a layman would know that he has a migraine?
Yes, actually, migraine is one of the commonest type of headache prevalent in the society. Another is the tension type headache. These two are the most prevalent headache, or we can say the most prevalent primary headache disorders. So you can say most of the headaches are either migraine or a TTH, in short, tension type headache. Migraine prevalence is around 65 to 70% population is suffering from migraine.
तो ये क्या मतलब अगर मैं ग्रोइंग एज है मेरी, अगर मैं एक बच्चा हूँ, तो किस एज में मुझे क्या बच्चों को हेडेक्स होते हैं? डू किड्स आल्सो गेट हेड?
Yes, 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 of course.
अच्छा और माइग्रेन
Kids can also have headache, and we have seen a 5-year-old kids having migraine headache.
वाओ!
Although there are so many causes of headaches, but migraine can occur in kids also.
अच्छा,
So, are migraine just headaches, or is it more than that? I mean, how do because headaches, there are so many types of headaches. First, just differentiating between that is difficult in its own. But because I've heard so many more symptoms other than just having pain in your head. So, are migraine just headaches?
Actually, migraine is a kind of headache which has so many other associated symptoms. Uh, Although there are so many other headaches also which has autonomic symptoms, and we can diagnose migraine on the basis of its semiology, its clinical presentation only, and we can differentiate other kind of headache with migraine with just a clinical presentation of patient. So, just what I mean to say, like migraineurs usually present with the one-sided headache, which is the most common presentation. The headache onset at the onset, headache is at one side only, but it can spread throughout throughout the head. But at onset, it will start either on the left side or on the right side, and the
Mhm.
sides are changeable with different episodes. Like the same person can have a headache starting from the left side, on the other episode, it is starting from the right side. It is not strictly on the one side.
Mhm.
And other associated common features are like nausea, like puking kind of
Mhm.
feeling, vomiting sometimes when patient has a very severe headache, uh, irritability to sounds like phonophobia or lights, which in medical term we say photophobia.
Mm-hmm. Yeah.
So these are the common symptoms, and usually
Uh,
migraine headache peaks in 20-30 minutes, and it lasts for like more than 30 minutes to 4 hours or so on. It may last for 8 hours, 24 hours or so on, but
तो
it should be more than 30
तो क्या
minutes.
एक बार मतलब अगर मान लीजिए कई बार एक ट्रिगर हुआ माइग्रेन का या एक परसेप्शन हुआ कि मुझे माइग्रेन मुझे ये हेडेक हो रहा है चालू हो रहा है सो आप कह रहे हैं कि वो 30 से 40 मिनट में पीक कर जाएगा in that period itself I'll have the
Yes,
peak experience of whatever headache means to me, right?
yes, usually it peaks in 30-40 minutes.
हाँ हाँ और फिर वो 4 घंटे से 8 घंटे 16 घंटे तक भी रह सकता है
That peak lasts for like 30 minutes, 1 hour or 2 hour, then it will like some headache remains, like some heaviness or some severity of headache may remain for a longer time. It could be 8 hours, 12 hours, 14 hours, or 2 hours, 3 hours only.
and is does it die down post that or one I mean in my personal experience the headaches that I have had now I don't know if they are migraine headaches popularly we call them migraine in the family but जब तक सो करके उठ नहीं जाते हैं अगले दिन तब तक वो सरदर्द तो हटता नहीं है
Exactly. Actually, sleep and food are the relieving factors. Like it could work as a like your herbal medication. Like whenever you are having headache, you if you go to the sleep after that, you might not have headache. Improvement हो जाएगा आपका headache में after sleep or after having meal. Like you are fasting for a longer time, like 4-5 hours, and you are hungry and you have started having headache. So as soon you have start your meal, it will like headache will like गायब हो जाएगा. It
हम्म। लेकिन क्या
just goes
उसके
off.
बिना भी कम हो जाता है मतलब मुझे ये तो पता है कि मैं जब सो के
Sometimes headache can improve by itself after its natural duration. But for that duration, it will be like very troublesome.
yeah
Patient may not be able to work properly, and he remain irritable. Efficiency will go down, not able to work.
so
And actually, there are two variants in migraine. One is the common migraine we say, which is just started with the headache and other symptoms like photophobia, phonophobia, and nausea. The other uncommon, but the classical one is the classical migraine,
yeah
which is started with aura, which is started with some visual symptoms, some blurring of vision or some dark spots in the field of vision, which gradually enlarges or which gradually goes in one direction, and they usually last for 15-20 minutes or 30 minutes followed by headache. So actually this aura precede headache. So this is the classical migraine, which is a bit uncommon. It is not common. That's why the other is the common one is common migraine, which is quite so common in the population.
in general if 100 people in India let's say they are having a headache usually मोटा मोटा क्या परसेंटेज इसमें माइग्रेन का रहता होगा मतलब जैसे पेशेंट
I
आपके
think
पास आते
60,
हैं
65, 60%
तो 60% लोग जो पहुंच रहे हैं एक डॉक्टर के पास वो माइग्रेन को लेकर पहुंच रहे
Yes. It is the commonest is migraine.
हैं अच्छा and is it so that this is a modern disease or this has always been there it's like पहले तो कभी नहीं थी
It has always
it's
been there
always been there
for a long time. So in our Indian setup, people say Ardh Kapari or kind of thing. ना जो common words हैं जो जो rural areas में popular हैं for migraine is typical is Ardh Kapari, and there's another word also. So people know they are having a one-sided headache.
so
They
migraine
say
is a
it Ardh
one-sided headache
Kapari. Actually, that is migraine.
so
It start with one side.
mhm.
It is not exactly one-sided. It start onset with the one side, then gradually spread all over.
there are many common conditions जिसको हम माइग्रेन से मिस्टेक कर सकते हैं, जैसे वन साइडेड पेन है, तो जो साइनस इश्यूज होते हैं बिकॉज ऑफ साइनस बीइंग अ वन, मतलब एक साइड अगर प्रॉब्लम हो रही है तो इट कुड ट्रिगर अ वन साइडेड हेडेक एज वेल. So how does one know the difference?
Listen, sinus is always be one-sided, which the sign, like if you have an inflammation in one side, sinusitis is inflammation of the sinuses.
Yes.
Sinuses over your face, like two maxillary sinuses and frontal sinuses.
Mm.
So if you are having frontal sinus, you will have a frontal headache around the eyes and around. So listen, there, migraine have a classical course of symptoms. As I have already told, like start with the one side, then spread all over, along with the photophobia, phonophobia, nausea, irritability, and all. Although all these symptoms may not be present in all the patients, some patient only
Mhm.
have headache, some patient only have photophobia with headache, some have only nausea with headache, no photophobia, no phonophobia. So
Mhm.
as Soumya asked about how will differentiate with the sinus headache, sinus is usually one-sided or at that sinus only. Suppose you are having maxillary sinusitis, you will headache or heaviness over the face. It is not actually the headache, it is actually facial pain,
Yes.
and it won't be associated with any accompaniments like nausea, vomiting, photophobia, phonophobia, and all. These all associated symptoms uh, must be missing in case of sinus headache.
So ये
And
साइनसेस की कोई स्पेसिफिक लोकेशंस है? Are there any
yes,
specific
yes,
points
yes,
which
yes.
are the...
Sinuses are located in the like over the face, just below your cheeks. So these two are the maxillary sinuses, and two are the frontal sinuses, and few deeper sinuses are there, which are like near the brain.
These are like some sac or something in the body?
Yeah, yeah. These are bony cavities actually. So these are for ventilation and probably for our speaking skills. So because air goes through them and the vibration help in producing the echo of that sound.
And irritability in them causes the sinus headache.
Yes, inflammation or infection.
Inflammation or infection.
If sinuses got infected, because sinuses have the lining of your, it has the mucosal lining, like you have in the oral cavity or like you have in the nose.
Yeah.
Inside.
Yeah.
So they are connected into the nose.
Yeah.
So whenever you got upper respiratory tract infection,
Yeah.
that means the infection of the sinuses and the nasal cavity. So that's why you have headache during cold.
Yeah.
So easy like easy way to identify the headache you have during the cold is like a sinus headache.
Uh-huh. Yes. But can a sinus pain trigger the migraine?
Yes,
Yeah.
any stress to the body can trigger migraine.
Trigger a migraine. Okay.
It is not only sinus headache, any headache. Like it is like if a migrainer is having sinusitis, his migraine will increase in the
Mm-hmm.
intensity as well as in severity. Like frequency will increase as well as the intensity of that episode will also increase. And sometimes it will be very difficult to differentiate whether he's having headache because of sinusitis or it is a migraine episode.
Yes.
So anyway, treatment for both both the headaches is same. Like yeah, if somebody is not having common cold or something, then we have to give NSAIDs only like Disprin or paracetamol,
Mm-hmm.
acetaminophen, and Nexdem, naproxen sodium, and all. So
Mm-hmm.
any anti-inflammatory drugs which will work for both, along with some specific treatments which are different for both.
Okay.
And
Uh,
and again, sinus headaches are short lasting. As the inflammation improve, as the cold improve, your headache will improve.
mm-hmm.
So I'll give you an example. I'm just taking this opportunity to get diagnosed. So usually what I figured out is that whenever I'm having headaches, one of my nostril, either one of them is not is kind of not active.
Blocked.
Huh. Not
You feel
not
one of the
blocked.
nostril is
Yeah,
blocked,
but a nostril is
stuffy.
definitely blocked. It's not cough blocked. It's not like I am running and
Yeah,
feeling
yeah,
a cough.
yeah.
Usually, my both nostrils are open because of whatever yogic practices I do. Now, so that was my cue into that being related to sinus and not to the migraine.
No,
That's like a fool's
that is not
practice.
sinus because your nose blocked during the headache only. It is not always blocked
Yeah,
or already
yeah,
blocked.
it's
Like
never.
this
Yeah,
is not causing headache.
yeah.
Headache is causing the blockade of your nose.
Mm.
And these are different headaches, which we say autonomic headaches. So it is a different group of headaches which are like close, which are in the close differential of migraine. So in our medical terminology, we say trigeminal vascular headaches. So these trigeminal autonomic headaches. So there are so many headaches which are associated with. Although migraine can also associated with that, but few classical autonomic headaches associated. They are usually strictly unilateral, either on one side or other side. They do not cross the midline, associated with some autonomic symptoms like lacrimation in the eyes, nasal blockade, eye redness, and all. They might be associated with phonophobia, photophobia, but those are not so common in that. They are commonly associated with some autonomic symptoms, like you said, like blockade in the nose and lacrimation, eye condition, and all.
So,
And their duration is different, might be different, like lasting for 20 minutes, 30 minutes, or maximum up to 1 hour.
so usually, in such cases, you're saying that headaches usually have a nature of not crossing one side to the other in general.
In one episode,
In one,
these autonomic,
fair enough. And if you could elaborate a bit on what are autonomic headaches.
there are so many autonomic headaches, like one is the cluster headache, another is paroxysmal hemicrania, and one is hemicrania continua. Their name is like they are strictly hemicranial. Cluster is classical uh, episodes of cluster of episodes of headache.
Yeah.
Like it occur in cluster. You have 2-3 episodes per day for over like 15 days or 1 month, then it goes off. Then it will occur after either after 6 months, 1 year, 2 year, again in cluster. Last like 2 to 3 episodes every day, last for 15-20 days or 1 month. That is specific for you. Then again goes off. That's why it named as cluster because it occurs in cluster.
Moving on to what causes migraine and what are the triggers of migraine. There is no particular reason that I know of that we can say कि इस वजह से माइग्रेन होता है, बट क्या कुछ ऐसे प्रीडिस्पोजिंग फैक्टर्स हैं, जैसे जेनेटिक फैक्टर्स या फिर कोई ऐसे बॉडी डिफेक्ट्स या बॉडी इश्यूज दैट कैन मेक अस, हमको पहले से पता चल जाए कि ओके आई एम मोर ससेप्टेबल टू हैविंग माइग्रेन्स और एनीथिंग इन दैट.
Uh, I think not in particular. You cannot know whether you are going to have migraine in your life, but definitely, as 65 to 70% of population is affected, to me it is like it is more than that. So every person have headache once or twice in his life. It could be migraine, it could be something else. And coming to the factors responsible, so there's some predisposition. Like if somebody is headache, somebody is having headache in your family, like your mom is having headache, or your brothers or sisters, or someone close in your family is having headache, like first degree relatives also. So you have a higher tendency to develop migraine, although it is not, you can say it is not exactly genetic or hereditary. I mean, it does not transmit
Okay.
or pass on in the generation, but there is some familial predisposition. Somebody have in the family, so you have more likelihood of having migraine.
Okay. Mhm. And then there are triggers. Like if we cannot figure out the
Triggers are
exact cause.
definitely theirs. Triggers are definitely theirs. So few are common triggers, common like common for everyone,
Mhm.
and few are person specific. So
Mhm.
common triggers are like bright light, loud noise. You say in general terms we can say shor sharaba hai. So
Mhm.
and fasting, inadequate
Mhm.
sleep, and
Yeah.
inadequate means not optimal actually. Either
Mhm.
you are sleeping more or you are sleeping less. Both
Mhm.
can precipitate your headache.
Yeah.
Fasting has a very strong correlation. And
Mhm.
fasting doesn't mean a whole day fast. Fasting means you are not taking meals on time. Like if you are
Correct.
not taking meals every 2-3 hours, some snacks in 2-3 hours.
Mhm.
Like you have
Dehydration
taken,
could.
yes, definitely dehydration also.
Yeah. Mhm. Okay.
These are the like common precipitating factors, and some
Mhm.
personal precipitating factors like, although these are also common like smoking, alcohol, any kind of alcohol, either it is wine or some other alcohol,
Mhm.
and some has precipitation with coffee, tea, chocolates, cheese, or some specific food. So that is specific or may vary with person to person. Like somebody has precipitation with migraine, but others don't have.
Mhm.
Uh, Somebody has precipitation with cheese or tea, coffee, while other might have improvement with tea or coffee. So
Mhm.
it might vary. So you have to find out your personal precipitating factors. Like आज मैंने ये खाया. Some people say जब भी ऑयली खाते हैं तब हो जाता है. Like पूड़ी खाई, समोसा खाया, then they have
Yeah.
precipitation of migraine headache. So that is specific for them only. It is not for
Yeah.
everybody. But
Mhm.
bright light, loud sounds, noise, these and fasting, these are and sleep. These are the common
Mhm.
factors.
Nowadays, when fasting is kind of intermittent fasting is becoming very popular.
No, definitely not recommended for migraines.
So in that case, can we say that we can train the body to live with that? So, for example, let's say for the first time somebody missed and they were getting the headache, and can they train their body to have a larger periods of less headache and move towards life where they are able to fast considerably?
I cannot comment on that. We need to study that actually.
Yeah. So it's not something. It's not
Because
like,
fasting is a
yeah.
very well known factor. Well known.
So you can't live with it. You can't really control when this happens, right?
Yes.
Mhm. So we can say this is very subjective as well because I've heard a lot of people say eating eating jalebi helps with
Yes, yes,
migraine.
yes.
So is there any
High sugar diet. Any meal actually.
okay?
Especially high carb diet might help in alleviating migraine, improving migraine. But any diet, like you just take your routine meal also, like roti, sabzi,
Mhm.
dal, chawal may improve your headache. And
Mhm.
most of the time it improves when it is precipitated by fasting.
Okay. Mhm. So we can yeah. So we can say that it is very subjective. So we have, if someone has migraine, that person has to figure out their triggers and also figure out what works for them or what doesn't work for them. So,
Yes,
very personal.
person has to work on himself.
Yeah.
He only knows what triggers for him. And if he
Yeah.
find out, then definitely he will have improvement. And these
Yeah.
are the lifestyle changes we suggest to our patients actually. Because we cannot put patient on medication for life now. So we
Yeah.
have to train them to find out the triggering factors, precipitating factors, so that we can reduce the medication and they just do well with the lifestyle modification only, or avoiding the triggering factors only.
Does therapy have any role in this?
Pardon?
Does therapy, as in psychotherapy, can that play any role in managing?
Yes, yes, definitely, definitely. Psychotherapy will definitely help, especially when stress is the precipitating factor, like any kind of stress, like familial stress or professional stress, or just there are so many reasons for the stress. So behavioral therapy not only will help in reducing the stress and make you emotionally strong. It will, I think, they will also teach you uh, around about the lifestyle modifications, proper, like how to live properly. How should be your daily routine? One should do proper yoga, proper sleep, proper hydration, proper meals on time, and what should you take, what shouldn't you take. So overall, your lifestyle along with the your mental peace.
I wanted to move on to this aspect only, like the psychological aspect of migraine. Understand the mind body connection. So, if could only having emotional triggers uh, activate migraine? Like then there is no need for any physical manifestation or physical trigger. But just because someone is having a stressful day, or someone is having a fight with their partner, can a migraine be triggered just because of that?
Might
जैसे हम कहते हैं ना कि तुमने मुझे सरदर्द दे दिया. So is that possible in?
might be, but actually it is multifactorial. When you have a fight with your boss, or when you have a fight with your colleague or a spouse. So there are so many, like whenever, definitely mental trauma is there, mental stress is there, along with the noise noise you both created
Yeah.
during that. And definitely you won't eat properly at that time under stress. Nah, you won't, like, you might miss your meal, you may not take your meals properly. So that would be multifactorial, but definitely it can precipitate. Like so many teachers says ki, like kids make so much of noise in the class, so that precipitate their headache. So noise definitely will, office noise or class noise doesn't matter.
So, people who can't hear, who have a challenge on hearing, are they prone to less prone to a migraine or a similar thing, or visually?
Very interesting, very interesting. Like till now I haven't encountered any mute patient
Yeah.
who is having migraine. Might be,
So this is like a
because definitely theoretically they should have
yeah.
very less chances of having migraine.
Yeah.
Again, there are so many factors. First, like noise is completely removed,
Yeah.
and because they are challenged, so they have a lot of emotional support also.
Yes.
Rather than having emotional stress, they usually have a better emotional support. So that might be the reason.
Yeah.
But I haven't encountered any patient who have like challenge of hearing and having headache.
And on that aspect, is it like having a headache in general? Is this something that one should treat beyond the quality of life that is getting affected? Is it an indicator of something deeper, or is it like a
Yes.
byproduct of your way of living, and you can live through and be? It's like पैर में चोट लगी हुई है, carry on कर रहे हैं चोट के साथ, right?
No, not at all. Every headache patient is not migraine actually. So every headache should be properly evaluated by a neurologist. And to me, imaging is mandatory. So one should must have one imaging at least to rule out any other causative factor for having headache. Because many times, although uncommon or we can say rare, but many times we find some unwanted things like tumor in the brain or some infections in the brain, which should be treated in time. So it is not just a headache. So like you can live with it, like you
By
can live with that.
imaging, what do you mean? If you could elaborate that.
Imaging in like CT scan of your head or CT MRI.
So anybody who is having frequent headaches, uh, one is they should visit a neurologist, so that so
Yes,
they should not take it very lightly. That's the first thing.
yes, yes,
And
yes.
at least to one annual scan on any time for,
Once in 2 to 3 years, like
yeah,
although one is more than enough,
yeah,
but yes, it can be repeated if there is change in the character of headache, or
yeah.
if a migrainer have a different kind of headache, then it should be evaluated again. And if he's having the same kind of headache every time, then he can continue with the old imaging also.
And migraine itself, let's say if somebody has migraine and not any other type of headache, then even then there could be something deeper than it hampering the quality of life.
Yes. Mm, organically, I can say no. There are so many biochemical changes in the brain, which precipitate your stress level, which may cause depression, emotional disturbances, and all. Usually, migraineurs are easily irritable. Like it may increase your irritability with the smaller things. But organically, brain is normal. Organically means there's no lesions. There's no obvious lesion which we can see on MRI or CT scan.
So it won't be very wrong to say that because you are having a migraine, there are certain lifestyle corrections that you are doing to deal with it all the time. And let's say you're not treating it, so आपकी लाइफस्टाइल इस तरीके से अफेक्ट हो रही है कि स्ट्रेस हो रहा है, आप इरिटेबल हैं, and that can develop certain other things, but uh, it itself is not an indicator of something uh, physiologically
Yes,
leading to something larger, right?
yes.
Yeah.
Yeah, after this discussion, I mean, as a clinical psychologist, I've seen a lot of patients with anxiety disorder. And in anxiety attacks, a person's heartbeat goes really fast, and that often triggers a headache. So, because they were diagnosed with anxiety first, they tend to either go for alternative medication or not actually treat their headache, but just maybe do some stress management. So, I mean, should I recommend people to actually go explore the headache issue, or I mean, how should one go about it? Because if a headache is being triggered every time the person is going into anxiety or any sort of difficult situation, so there could be something more to it, and just managing the stress would not do. Should we explore into that?
So I think migraine and anxiety can coexist, and there is strong correlation.
Yeah.
And definitely, anxiety could be a precipitating factor for a migrainer, but it cannot
Hmm.
be a causative factor.
Hmm. Yeah.
So if you are a migrainer and you are having anxiety issues also, so with
Hmm.
anxiety your migraine may precipitate
Yes.
even with
Hmm.
each and every episode of anxiety, or in some episodes.
Mhm.
So when we give a medical treatment for migraineurs, we actually see what are the comorbidities patient is having.
Yeah.
So we choose
Mhm.
the medication according to that only, so that we can treat every comorbidity or all the comorbidities along with migraine with the one medicine. There are medicine which will work for migraine as well as anxiety. There are
Yeah.
medicines which will work for migraine as well as depression,
Mhm.
mood disorders. So there are different set of medicines we use, like patient, if patient is having mood disorder, bipolar disorder,
Yes.
having
Mhm.
migraine also. So we have a
Mhm.
different set of medicines for that. With a single medicine, we can treat both the things.
Yes.
So
Okay.
it is just an association between these two. None of these
Mhm.
are causative factor for either.
Okay. Mhm.
It is just an association.
Mhm. Uh, and a lot of time people go for just alternative medication. So if it is helping them, someone is uh, doing some nuska or something that they have been told, and it is working for them. But should that be the only treatment? Because, and if not, if we are treating it, if you're not treating migraine properly, then what could be the consequences of it?
Listen, migraine is a benign disease, and if any alternative medicine is giving improvement to someone, he can continue with that. There is no issue. After
Mhm.
all, your quality should be better. Quality of life should be
Yeah.
better, and you should be headache free. Your days should be headache free. Doesn't matter whether your headache free days are because of pharmaceutical agent or some alternative medicine, or just lifestyle changes, or just avoiding the precipitating factors. But whatever you are getting, it shouldn't have a serious side effects.
Hmm. Yes. And like, if not treating it at all, if we are not treating migraine at all, just managing the triggers, does that, I mean, in the long run, could it have some severe effects?
Yes, yes. It can cause, although till now not much have been reported, but actually during migraine there is a constriction of the brain vessels, like blood vessels in the brain. So which causes minor changes in the brain, minor damages in the brain, which may not be visible in the MRIs. Actually, till now the pathophysiology of migraine is not very well understood to us also. But definitely if remain untreated, then the frequency will increase with time. It will definitely will difficult to treat later on, and definitely it will interfere with your productivity and your daily life. So like initially you have one or two episode in a month, required only profile only SOS treatment. But when you have more than 3 episodes in a month, then we need to give a regular treatment. If you don't take medication at that time, it might increase to 10 in a month, then every day in a month. So once you are having everyday headaches, definitely your productivity will suffer, your life will suffer, your emotion, you will be emotionally uh, like disturbed all the time just because of headache. Although they are not very serious consequences, but definitely your quality of life will be very poor, and productivity will be very poor.
So, let's say if somebody is having migraine, right, and as a patient they come to a doctor, and let's say they were going through a severe bouts, set of severe bouts of headaches. What kind of treatment should they be looking at? I mean, would it be a certain medication that it gets handled from? What duration would that be, or is it like it's to be managed? Like, for example, I have a thyroid deficiency, so I'm on the pill for I don't know how many years, right? I don't really know what effect it would have if I don't take those medicines. but just to make sure that the marker is right, I'm having it, and it's been more than 10 years, maybe 15, maybe 20. So similarly, I know people who have migraine, and it's very severe for them. Would there be a day when it would be there? Could there be a time that, okay, for this 1 year there's no migraine, right? Or let's say beyond a point in time it's treated and there is no migraine that's going to be happening, or is it that they are going to be managing it somehow by taking certain pills, maybe living in a given way? Is it something that gets treated at all or is managed? That's the first question in a precise fashion. And the other thing is, if it, in either case, how does the overall treatment look like or the management look like? Once the first time, let's say I come and meet you as a patient, how does it go?
So we can divide treatment of migraine in two broad headings. Like one is for your acute headache or just relief from the headache, acute episode or any headache episode. And another treatment which we call as prophylactic treatment, through which we reduce the frequency of having migraine. Like you are having 5 episodes in a month. So our aim is to reduce it to one or once in 2 months. So there are two kind of medication we usually give to the patients. One is to just treat the headache acute episode. So the for those SOS medications he can take. We usually give any NSAIDs. There are so many drugs like simply Disprin, naproxen sodium, paracetamol, and on the second line treatment like ergotamine and triptans. So at present there are so many preparations like pharmacological treatment as well as some other devices also has come in the market. Like they give some mechanical stimulation, so you always not to take any pills for reducing the headache, although the efficacy of those devices still under the trial phase. But definitely for SOS medication, there's so many medications which will improve your headache within 1 hour. And sometimes we have to give injectables or subcutaneous injections or some nasal sprays also of these pharmaceutical agents. And for prophylactic treatment, there are so many medications which patient has to take regularly every day, whether he is having headache or not, so that the headache frequency goes down, headache intensity and severity goes down. And once patient respond to this prophylactic therapy, we used to continue for 3 to 6 months. And in this duration, we train the patient to lifestyle modification, find out his precipitating factors, and then so that we can taper off that medication. So to me, everything is treatable. Treatable means just controlling that any disease with the medication. We are just controlling. We are not just curing. Cure means total resolution of that disease, and it will never recur. So cure is different,
Yeah.
but the treatable is different. So migraine is treatable. We can reduce it once, like we can reduce it to the extent like patient may not having headache for years, like headache free intervals for 1 year, 2 year or more. But it may recur. It may recur at any time whenever there are precipitating factors, or maybe spontaneously also.
Yeah.
But I have seen so many patients who remain headache free for 5 years, then again came back, साहब फिर से हो गया मुझे headache. वो मैं ठीक थी इतने दिन से, 5 साल से ठीक था सर.
तो जितना मुझे समझ में आ रहा है, उससे people are born with this trait to get migraine, right?
Yes.
The one who is
Yes.
not born with it may never get it. It's not that they develop it over time.
Yes.
And
It may increase over time, but it won't, like somebody will not develop it.
yes, and the treatment one is on the managing the acute I would say,
acute episode.
episodes. And at the same time, uh, it also comes out with the lifestyle change and some sort of a physiological, I would say, change coming out of the lifestyle change, right? That helps one manage it much better, taking it to almost zero. Even that is a complete possibility. Is it possible that people may confuse a neck pain or a pain somewhere on the backbone or upper part of the neck, right, with a headache? Or are these, could they also be related? I'll give you my example. Uh, I used to get a lot of headache, which I always thought were migraine. And I changed my pillow, and the frequency of those headaches came down drastically. Now I'm also confused if they are sinus headaches, but that aside for now. Uh, Now, whenever I've used that pillow back, I get headaches. So there is a correlation practically for me in my behavior. So could neck pain or neck induced pain also people might be confusing it as headaches? Is that possible? Or is it
Yes,
a headache
yes, definitely, definitely.
emanating from the neck?
Yes. So, as I have already told initially, another primary headache is TTH, tension type of headache.
Hmm.
So, that tension type of headache is actually headache in the posterior part of your head, or having headache in the posterior part like occipital region and the neck and nape of the neck extending up to the shoulder and even upper back. So this is in which you feel tension in the muscles, like you feel pulling sensation or tense feeling in the back of neck, which is actually a headache, which is not a muscular pain or neck pain arising from the cervical problems. Yes, definitely it could be postural, like in your case. So postural pains are different. It could be headache, it could be bad backache, just because of your poor posture or a poor alignment of your muscles. So definitely that person has to find out.
And
It is more common with the backache actually. For
would massages help in that case?
yes, definitely massage will help. Massage will help in migraine also.
So if I am going through it's on a particular day when I'm having a migraine, a headache, right? Uh, it's actually advisable to take a massage that day.
No, no.
No.
For migraineurs, it might not be helpful. Actually, for migraineurs, patient might have severe headache even on touching. Like migraineurs, even not able to calm their
Yeah.
heads, like hairs during headaches, because there is some hypersensitivity in the skin of that area, particularly over the head. So whenever you touches that, it may actually causing severe pain. So especially in migraineurs, it is not advisable to have massage. But in this neck pain, like in TTH, it might be helpful.
And TTH induced headache is not migraine.
No, TTH is another different
Type of a
primary
headache,
headache
tension.
type of a
Yeah.
headache, which is like migraine only.
Yeah.
Like migraine is a primary headache without any known cause. Similarly, TTH is again is a primary headache without any known cause, and it is again as common as migraine, a bit less common than migraine, but so common.
And just sneaking in another question there. In case somebody is having a TTH, it could be due to, as I said, that in my case, probably it was the pillow. So while people are lying down resting, they might be exerting a lot of pressure on the head. So
Yes,
is there not a,
definitely it could be postural.
so it how do I come to understand what is the right posture? Where do I get that training from? What are the resources? I mean, if I think on that now.
Listen. It is a very simple answer for that. Is what is your primary position? Your primary position is like straight with shoulder in a primary position with head straight, neck straight. This is your primary position, and you are most comfortable in this position only. And any deviation from this position may cause your neck pain, head pain, shoulder pain, or any headache. Like if you are sitting like that, definitely you will have, or sleeping like that, sleeping like that,
Yeah.
like with extended or flex neck. So simple answer is you just try to maintain your primary position even during sleep or most of the time, even when relaxed. The same is the answer for your pillow also. Like when if you are sleeping with the sidewise, then you have a thick pillow, like thoda sa mota pillow chahiye.
Yeah.
And if you are sleeping straight, then you have a very thin pillow. But you need a pillow always.
Wonderful. That answers a lot of our questions. Now our audience has a good number of questions that have come in. We'll try to take up as many, but we can take up only the time allows us only to take up that few. So we'll go to the first question. This question has come from Mumbai, from a woman aged 27 years of age. Uh, it goes like, I have been struggling with migraines that seem to get worse around my periods. It follows a predictable pattern starting days before my period and lasting up to 7 to 10 consecutive days at times. Despite trying numerous treatments, nothing seems to provide long term relief. Why do migraines often have such a strong connection with menstrual cycles? And what can be done when conventional treatments and medical advice fail to address the severity and frequency of these attacks? Are there any hormonal treatment that might actually help, or could they just make things more complicated? So, a lot of questions from this lady. Four of them, in fact.
Actually, it's a common issue actually, as she had raised. Uh, it is quite common in actually migraine is common in women's first of all, and with 4:1, like four times higher in women's
Wow.
in compare 3 to 4 times higher in women's in comparison to men. And definitely during periods there is tendency to increase headaches, but in some women's headache occurs only during menstruation or like perimenstrual period, like just before menstruation to 2 3 days after the menstruation, like periods. So for that, a definite term we had given is catamenial migraine, or we can say catamenial component of migraine, when there is strong correlation with the periods in case of women's. So it has two important points. One is that migraine has a very important correlation with your hormonal balance of your body, because in women's always have so many changes throughout the cycle, throughout the menstrual cycle. Like sometimes progesterone is high, another time estrogen is high. So it has a strong correlation, and during periods, headache usually worsen, and some women have headache only during periods. So the treatment is again more or less same as common migraine, but there are two few different things. Like SOS treatment is same. SOS, like we have to give the same medication which we give to alleviate any episode of migraine.
Mhm.
And another thing is we can give a short-term prophylaxis. Usually, most of the women's know what is the expected time of their period. So, what we advise to start taking NSAIDs 2 to 3 days before the periods and continue regularly, even 2 3 days after the periods. So, it may alleviate in most of the cases, and in some refractory cases where this doesn't work, in those cases we have to give a proper prophylactic treatment, or we can give a hormonal treatment like oral contraceptives and all, so that we can like then there would be no menstruation, no periods, so they won't have headache.
So it's comfortable, or it's all right to say that post menopause, these bouts of migraines will go down.
Yes, yes, definitely they will go down, or usually it improve with age. For migraine, it is truth actually. Ki with age, it improves, and definitely in post menopause, it is like very unlikely somebody to have migraine after 50 years of age.
Hmm. We will go to the next question, which is from Pune, from a male, age 34. Uh, I had my first migraine attack with aura when I was 14 years old, and it was terrifying. I lost vision while struggling to speak. Uh, all this happened before the headache started. Over the years, my attacks have become more frequent and intense, with symptoms that include severe pain, visual disturbances, and temporary disabilities. It's really unsettling, and I often deal with isolation and lots of anxiety. How can I better manage these kinds of migraine with unpredictable symptoms and manage my life and responsibilities? Is there something I can do to control these?
This patient is actually having classical migraine. So in classical migraine, patient initially have aura. Aura could be aura, usually a visual aura, like black spots in front of your field, or just shutter is going down, or these black spot expanding and causing total blackout, and they last for like a variable period, 10 minutes, 20 minutes, and usually precedes headache, and as soon as aura disappears, headache starts.
So, what is this aura? What does it mean to
Aura is
harmony?
aura. Aura is the term given to these abnormal feelings. So usually, like we used to say, aura, for this aura is the visual aura. Patient may have sensory aura, like some tactile feeling, abnormal feeling over the body, although that is uncommon with migraine and common with other diseases. But in migraine, visual aura is quite common. So it gave us some insight that this headache actually start from the occipital region, which is the control for our vision. So actually, some depression is starts from the occipital region of our brain and spread or move forward with a very slow speeds. And as soon as it reaches to the frontal region and the brainstem region, especially in the pons and hypothalamic regions, this aura disappears and headache starts.
So, going back to his question, how can he better manage these kinds of migraine and
Management of common or classical migraine is same.
same?
There is no difference.
Hmm.
Patient having aura can take medication during the aura period. There are some medication which has to be avoided during the aura period and given only when the headache starts. But normal painkillers, normal NSAIDs like naproxen sodium or aspirin, disprin, paracetamol, he can take anytime, or as soon as patient take the medication, headache will improve.
What we'll also be doing, we'll be sharing the contact details for Dr. Hariom Singh's clinics. So any of these patients, if they would want to, and anybody who's listening to this podcast, if they would want to book a session, they can. Dr. Hariom, is this it's possible for you in neurology to see remote patiently? Sorry, see patients remotely, or they have to be
Yes,
physically?
yes, definitely we are doing online consultations, so patient can consult online.
So what we will do is we'll be enabling his profile on AUMHUM itself, so that you can book a session if you would want to. Of course, you have to conform to his very tight schedule, and I am sure this will be a very wonderful experience for you. I'll go to the next question quickly. This is about migraine with limb weakness, hemiplegic migraine, as the other person has told me. So this is from Bhubaneswar, again from somebody age 28. So the three questions that I have seen till now are all from very similar age groups. This is from a male. I've been having migraines that come with tingling sensation. Wow. Let me repeat that. I've been having migraines that come with tingling
Got it.
sensation and weakness in my legs, mostly on the left side. How are these connected? What should I do if this happens? And could this be a sign of something more serious? Uh, how can I ensure that I am getting the right care?
Listen, it could be a variant of migraine. Actually, there are so many variants. I have discussed only two, the common and the classical one. The other variants are like basilar migraine, in which the patient have dizziness, vertigo, and all, or the stem like symptoms of the brainstem area. And as this patient is having, this is typically hemiplegic migraine, in which patient feel weakness or abnormal symptoms in one part of the body during the headache. And sometimes patient may not have headache, or he can have only weakness on one side. So sometimes it's very difficult to differentiate whether these patients are having stroke or actually it's a part of migraine. So anyway, if headache is present and patient is a known case of hemiplegic migraine, treatment is again same as for common or classical migraine, prophylactic as well as SOS treatment.
Yeah.
That doesn't differ, but I prefer MRI in these patients on imaging wise rather than CT scan. In most of the cases, CT usually suffice for the imaging purpose, but in certain cases, like especially in basilar migraine and this familial hemiplegic migraine, we need to do MRI also.
So we'll go to the next question. This question is from Bangalore, again from somebody age 28, a male. Uh, I've been dealing with migraine on and off for last 5 years. But since switching to a new job where my screen time has increased dramatically, I've noticed my migraines flaring up much more often. In fact, I've always known stress could trigger my migraines, but the connection to screen time is something new to me. The long hours in front of the screen combined with the usual work related stress seems to be making these worse, as per my understanding, as this person is narrating. Uh, are there effective ways to manage both the stress and increased screen time to help reduce the impact of my migraines? Any tips on how to prevent migraines caused by sitting at a desk for a long period, staring at screens would be really helpful to me.
Definitely, screen uh, to me. What I have understood, actually, the brightness of a screen, which is actually the precipitating factor in migraineurs.
Mhm.
So, what he can do, he can reduce the brightness of his screen, and especially brightness and glare. What he's feeling.
Yeah.
So he can use additional screen or film over the desktop or laptop. So it will definitely alleviate, or it will definitely help him.
Hmm.
And another thing, like continuous working, one should avoid. He can take a break in 30 minutes or 1 hour, just for 5 minutes. He can go out, take some fresh air, and come back and sit. So this might help. Rest other will remain the same. Like rest, prophylactic treatment, SOS treatment is same for each and every migraine.
So,
Lifestyle modification may differ person to person. So this is the lifestyle modification or a professional modification, how to manage.
so
So he can manage.
this brings out another related thing, that is it like usually should we have less bright lights in the house?
Yes, definitely. For it definitely will be helpful for migraineurs.
Hmm. And in terms
So
of
it should not have glare actually.
okay,
So what I suggest to my patients is to buy them cloudy goggles, like shady goggles, like cloudy shades,
yeah,
dark cloudy shades, not any other shade. So you can say gray or little darker gray shade goggles. So
And
which actually decrease the glare of sun.
so similar to the glare in the visual aspect, is there something in the hearing aspect as well that a lot of noise is triggering?
Hearing again is the loud voice.
तो कुछ ऐसी साउंड्स भी होती हैं
Slow
क्या
music,
जिससे
slow
जिससे
music
हम
might help.
अच्छा जैसे किशोर कुमार को कोई सुन रहा है तो वो इट्स बेटर देन
It might help.
इट माइट हेल्प
It might help. And frequency of sound definitely have some correlation, although not studied properly or not reported anywhere. But to me, I think high frequency, or you can say high pitch sounds, like that mosquito sound, or a voice of a lady is uh, more precipitating for or more irritating for migraine, because ladies have a very high pitch sound, high frequency, high pitch, I think.
I'll use that. I'll use that as a weapon next time. uh, yeah. So before we go to the and Soumya, you have to take the next questions. A couple of them. Uh, uh, on this point, right? So I have personally found taking rest to be an effective medicine whenever a headache occurs, irrespective of whatever it is. But at the same time, I have an urge to complete my meditative or yogic practices that I usually do. But I have never found, and this could be on a lack on my part, it's not a judgment on the practices. It to be very really difficult to sit and do when I'm sitting, even if I'm not concentrating, meditating, as in being there with my eyes closed, sitting, not doing anything, comparing that to sleeping when I know that I am here resting, right? I'm not resting in the both. Is it advisable or is it not advisable to do even a meditative practice when somebody is having a headache? Can that even flare this up?
Listen, that varies, or that should be individualized. Like you have to practice what suits you.
Yeah,
Like if you are having improvement in migraine or headache with yoga, meditation during headaches,
yeah.
then you can practice that. But it is not a rule that it will always worsen or it will always improve. And sleep or rest on the bed will improve. It may not improve, but definitely it won't worsen.
There's a very popular video on social media where somebody is saying that whenever you are getting a migraine, soak your feet in hot water so that the blood supply to brain goes down and your headache goes down.
Soak your
Soak your feet in hot water, in warm water. Keep your feet in warm water so that the blood supply to the brain goes down and your headache goes down. Should we give any credence to
I don't know how will it work. I don't know.
that's what I'm
It might have some placebo effect, or it may work for some,
yeah.
but it
But
may not work
clinically,
for others.
it's not that a blood supply has any role in amount of blood supply has any role in causing a headache or reducing the experience of headache.
Till not proven. Although initially it was thought
Yeah.
that during migraine there is a vasoconstriction in the brain in the initial phase, later on vasodilation. But at present, with the current availability of functional MRI and flow studies during the headache, uh, it has never been found actually, or never proven that blood supply of brain has reduced during migraine, although it was initially thought.
Yeah, so the next question comes from Jaipur, a 32-year-old female. After experiencing a break from my severe migraine attacks during pregnancy and a few years after, I was kind of shocked when they returned with even more intensity, complete with vision loss, difficulty speaking, and intense, really bad pain. Why do some people experience a significant remission of their migraine only to have them return more severe than before. Is this a common occurrence, and what might be contributing to this sudden and intense resurgence? How can I manage the fear and disruption these attacks cause while trying to understand and cope with the underlying reason for their return?
Listen, migraine was always there in that case. What happened during pregnancy? The pregnancy is a different physiological state.
Mhm.
So, for migraineurs, pregnancy might be a very good phase of their life. It totally disappear during pregnancy. Not in all, but 60 to 70% of patients migraine disappear during pregnancy. Maybe because of the hormonal changes of the body at that time, as I have told earlier, like the catamenial component. So during pregnancy, again, there is different hormonal profile of your body, so which might improve migraine during that period. After delivery, during lactation, it remains suppressed, but after lactation, it may recur with the same intensity or maybe with the more severe or lesser intensity. That may vary, but it will definitely recur. So at that time, again, it has to be treated properly with the pharmaceutical agents like SOS as well as prophylactic medication.
Yeah. Moving on to the next question. This comes from Kochi, male 46. I have lived with chronic migraines for years, and I saw my mother go through the same thing. It's been a constant battle affecting so many aspects of my life, my work, relationships, and overall quality of life. The unpredictability, the cost of treatments, and the toll it takes on mental and physical health has been overwhelming at times. Now, my teenage son has started getting migraines, and I can't help but feel scared for him. I know firsthand how debilitating this condition can be. Will it affect his studies, friendships, or his ability to live a normal life? How do we best prepare him and ourselves for what's ahead, especially as we are still figuring out his triggers?
Listen, this family has a very strong inheritance of headache. Actually,
Yes.
mother had, son had, now grandson is also having migraine. Definitely, this is migraine, nothing else.
Mhm.
So that there are, like, as I have already told, there are like migraine run in the family.
Mhm.
It may affect so many members of the family, like father, son, brother, sister, even first degree relatives like Mosi, Mama, and all. So anybody
Mhm.
can have migraine, and it can pass on. Not necessarily, but it can pass on. So, like in this family, it is passing on to the next generation, and definitely it is controllable. It won't suffer with his studies. He can do everything. He can study everything. Doesn't matter. Whatever he want to study, he can do. Whatever he want to do in his life, he can do. Migraine is not a severe disease. Familial predisposition is there, which is clear cut, visible in this family, and treatment is same for all. Like,
Mhm.
uh, actually, he shouldn't be worried if he has taken proper treatment and proper lifestyle changes. He can teach his son also.
So there was a sentence that was in this question that it's a costly treatment. Is it a costly treatment?
No, not at all. It is not costly. I don't know why he's saying so,
Hmm.
because cost of treatment for migraine might range for hardly 1,000 rupees in a month,
Hmm.
which is, I think, not so costly.
Hmm.
Even less than
Includes
that,
the
1,000 is
medication.
a little exaggerated.
The mental health cost as well, like the mental health toll it takes. That could be one
Mental
thing.
health, admission, and
Yeah.
definitely, like, if he is skipping from the office because of that, that cost is
Mhm.
more important than the medication cost, actually.
And I think that it's a good thing that in family they already know what the treatment is like, and
Exactly.
they can
They
support
must
her
be
child
knowing
better.
properly, and he should not be much worried about that. Like,
Yeah.
he must
Yeah.
have discussed with many neurologists,
Mm-hmm.
or either
Yeah.
that might be he didn't met any neurologist till now. He
Mhm.
might be consulting general physicians or
Yeah.
or other doctors.
Yeah. Okay, so moving on to the next question. Agra, 35 male. My wife has struggled with migraines for years, and while I do my best to be supportive, there are times I feel completely helpless seeing her in so much pain. I want to do more, but I'm unsure how to be truly helpful without overstepping. What can I do? How can I help to be more proactive in supporting her during her worst migraine days while still respecting her space and needs?
Hmm. So it's again very like very common day to day issue, because headache is migraine is more common in reproductive age group. He's a young, I think 34, 35. His wife
Yeah.
must be in the
Mhm.
reproductive age group. They have to plan family and all, and at the same time they have to take medication, and there may be so many queries in their brain, whether we should take medication or not, whether if my wife would conceive during the, like, while she was taking medication, so how these medication will affect the baby and all. So there are so many questions in this query actually.
Yeah.
So again, there are different pharmaceutical agent we use in reproductive age group, uh, especially those who are willing to have a baby, or those who are planning a family. So so we we give medication which is safe in pregnancy also, or which will not suffer in uh, having conceived, or which will not suffer during pregnancy, which don't have any side effect with the baby. And rest treatment in this reproductive age group, we have to just take care of these points especially.
Can arousal increase somebody having a migraine, or can it spawn a migraine?
It is a different headache. Actually, there are so many other kind of headache which
There is some.
occurs during exercise, like exertion induced headache, which occurs during reproduction, like mating. Uh, there are so many other kind of headache. Usually, migraine does not precipitate
Okay.
with the sexual activity.
Okay. Yeah. So the next question is from Mysore, a 24-year-old female. I've recently started experiencing migraines and I'm still evaluating different treatment options. I'm hearing conflicting advice. Some suggest Ayurveda, others say to see a neurologist, and family members recommend yoga and diet changes. How do I decide the best course of treatment when there's so much conflicting advice around me?
Listen, family advice is correct actually. So yoga routine, daily daily lifestyle modification is definitely important. Anyway, any
Mhm.
doctor will suggest that also. And
Yeah.
and for migraine or for any headache, it's better to consult a neurologist rather than consulting any other uh, physician, or any other
Alternative.
alternative medicine like homeo, ayurvedic, or
Yeah.
although they might work, ऐसा नहीं है कि वो काम नहीं करेंगे. I can't say because I am not in that field. They might
Mhm.
work.
Is it right to uh, is it all right to say that if somebody is getting headaches, the first doctor they should go for is a neurologist for headaches?
Yes,
Because it's
if
very
there is
difficult to
availability
decide
of
what
a
to
neurologist,
do.
is there, they must go to the neurologist only. If neurologist is not available nearby, like in their surroundings or in their town, then they can consult a physician also, general physician like MD medicine people.
Yeah.
So they can do initial workup, they can give initial treatment, and if there is no improvement, they can refer it to a neurologist. Like practice in Western countries.
Yes.
Like first you have to consult a family physician, then only he will refer, because
Yeah.
like appointment with the neurologist is quite difficult there.
Yes. And just to add to that, to our international audience, Dr. Hariom, you can always book consultation even if you are in New York or in New Jersey or New Orleans. So there are some of the questions that have come in from our international audience. This question has come in from Australia, from a 35-year-old working mother of two. I've been experiencing severe migraines for past 3 years, and they often strike when I'm trying to manage my kids' routines and my demanding job. It feels impossible to juggle it all, especially when the migraines are at the worst. What practical strategies can I use to manage migraine while balancing my family and career responsibilities?
Yes, it totally depends how frequently she is having headache. If she is having headache more than 3 times or more than 3 days in a month,
Yeah.
then it's better to consult a neurologist there, and she can take prophylactic medication along with the lifestyle changes. So definitely she will have improvement with that, but
Good.
she needs medication.
So early on in life, I had a time period where I was getting a lot of migraine attacks, and I have a background in psychology. I have studied a lot of psychology, so I feel that I tend to move towards seeing the stress aspect of it, and I saw a connection that whenever I'm physically feeling weak, or physically like I am ill or something like that, and then there's some sort of mental stress, then I would have migraine attacks more. So, could I be having some sort of biasness? And I feel that maybe because I've studied psychology, so I move towards stress. But a lot of people read a lot of things in on Google as well and make certain biases. So, uh, how can I not go into that spiral of like figuring out maybe this, maybe this, maybe this, or just just how do I feel okay with whatever is happening and find out on one particular thing rather than just going all over the place.
Listen, stress could be a precipitating factor, and as I have told you earlier, like one should has to find out his precipitating factors.
Mhm.
So there's no harm in finding any correlation. Like as you said, yeah, I had a correlation with mental stress or some emotional
Mhm.
stress. So this
Yes.
could be true actually.
Mhm.
So, so actually, you have to work on reducing that stress rather on just
Mhm.
finding the correlation.
Yeah. Mhm.
We'll go to the next question, uh, and this would be the last question for the day. I have at least 15 more questions out here, but unfortunately, we won't be able to take them today. But maybe some other time. And this question is from a 50-year-old lady who enjoys running marathons. I love running and I've been training for marathons for years. But recently, my migraines have been getting worse after intense workouts. Is there a connection between exercise and migraine? Even without going it to Dr. Hariom, what I have understood from it is that there could be. And should I change my training schedule to avoid triggering them while still staying active? I'll let Dr. Hariom take this one.
Yes, definitely, there is a strong correlation uh, with exercises and actually exertion. When you are exerting yourself, and for marathoners, it might be dehydration only.
Yeah.
So, whenever you are doing marathons or long runs, you have to hydrate. Like your hydration is the most important thing while running. Like I am also a marathoner, so we know. Sometimes we also have headache. We both, like me and Rashmi, both have headaches. Whenever we do long runs and we didn't take hydration properly, we have headache. So this is a common thing which we are also facing, and we know this is because of poor hydration intake, poor water and electrolytes intake. So what we used to do is we take care of hydration properly to avoid this, and definitely we are able to avoid this with hydration only. It is not, sometimes it is exertion, it is weather also. Like if you are running at 44 degree or 40 degree, definitely it will cause headache. There may be some multiple factors like sun over your head, too hot, again dehydration also. So there are so many.
I also have had a good experience of running, and or to this, not from a medico perspective, but as a just as a runner, I would say that many times it's easy to understand your regular headache that you're getting because of dehydration with migraine.
Exactly.
And
Exactly.
what I used to do, I can share.
Migraineurs will say that migraine because they are used to of migraine.
Yes.
Otherwise, it could be a regular headache
Yes.
just because of dehydration.
The first few days when I used to run and I was not used to plan my hydration, I would get a lot of headache. And what I used to do then on is to drink water. But then I would say, an endurance runner told me that this could affect your kidneys. So don't do that. Don't have so much water. And then I shifted to carrying salt with me. I would just take some salt every 45 minutes. So if my run is for 4.5 hours, I'm talking of a full marathon, 4.5 is what I have experienced doing that. Every 45 minutes, I would just pop one salt capsule. And I never had headache after that. But that's my personal experience. Not taking away anything. It could be migraine, as Dr. Hariom said, or it could be dehydration.
It could be
Could
migraine,
be a
it could be simple dehydration or electrolyte imbalance.
So, but one thing is for sure, you can at least add this to your routine so that maybe
Yes,
your headaches
yes.
go down.
That's why ORS is more important than water.
Yes. In fact,
So
it
ORS
reminds me
tablets,
of.
like whatever you are taking, I think these are ORS tablets. It
So,
has sodium, potassium, and probably magnesium also. But during exercise, hydration and electrolyte intake is very important. Not only for migraine, just for your routine health also.
yes.
Because this electrolytemia is very common, and it may cause a very untoward event, like what are happening. You say na, somebody has syncope, somebody have cardiac issue during the run.
Yeah.
These are just because of electrolyte imbalance, and these are just arrhythmias patients are, like runners are having, because of electrolyte imbalance, because of poor hydration and electrolyte intake during running and exerting themselves. So it is a different thing, like it is not related to migraine.
Yeah.
But with exercise, you have to be very careful about your heart rate, about your hydration, about your electrolyte intake.
So this is like a conversation starter for those who are interested in the physical health and neurology combination. Someday we will bring in Dr. Hariom to talk about that. Uh, on that note, uh, I would like to thank Dr. Hariom, who's been gracious enough to bear with all the questions of all
Welcome,
we
and
had.
thank you so much for inviting me. It was
And
a very nice and pleasant experience.
we would love to have him
Yeah.
back at the appropriate time.
Sure. I will always be there.
And to all our audience, wherever in the world you're watching or listening to this, do subscribe to one of our channels. Download the app if you would want. And as I had mentioned before, we would be putting out contact details for Dr. Hariom. His link would be available to book a session if you would want anytime. or if somebody that you know needs this. Thank you so much for watching.